welcome to today's Health and Human Services Committee hearing. I'm Councilmember Priscilla Tyson, Chair of the Health and Human Services Committee. I also would like to recognize Councilmember Shayla Favor, who has joined me for this afternoon's hearing. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. The subject of this afternoon's hearing is the Commission on Black Girls. On July the 16th of 2018, Columbus City Council adopted resolution number 00208X-2018 to create the Commission on Black Girls. The commission was charged with studying the quality of life of Black girls 11 to 22 years old in Central Ohio. Further, the commission was established to develop and implement recommendations to ensure opportunities, successful futures, and the achievement of a high quality of life for Black girls in Columbus. Since its inception, the commission has remained committed to its charge, and on July the 30th of this year, the commission officially released its report, titled A Report on the Quality of Black Girls in Columbus, Ohio. This report, which includes recommendations, is not only significant to our community, but it sets a national precedent. This is the first known report of its kind that has been done by a city government entity. Today, I will provide an overview of the report and the recommendations. The resolution that established a commission also included a provision stating the commission would exist until December the 31st of 2020, unless prior to that date, council enacts legislation to make the commission permanent. As December 31 quickly approaches, it is imperative that we take action to continue the work of the commission, so we will also be discussing the next steps for the commission during this hearing. Today, I not only have the pleasure of hosting this hearing, but I will also be presenting, and in addition, Toshia Safford, the president and CEO of the Center for Healthy Families, will be presenting remarks. I now will begin the presentation. And I don't know, before I start, Councilman Faber, do you have any comments you'd like to make before we get started with the presentation?
No, I'm very excited to see the rest of the presentation. I've been excited about the commission and the work of the commission for quite some time now. I am excited that the report has finally been released, and what a successful event. Councilmember Tyson, you hosted for our young girls just a few weeks ago. So just welcome everyone who has joined us today, and excited to learn more about the next steps for the commission.
Thank you. Thank you. And so we're going to go ahead and begin. So we're going to have a number of slides to share with our viewing and listening audience. And so think about the idea of the commission. It really was, how can Columbus improve the quality of life for Black girls? And to be able to do so, we know that we have to involve the community to help us to answer that question. And so we commissioned a study. And so we are now going to share the results with the community. And then we created this report on the quality of life for our Black girls. And the number one recommendation from the report, and you'll hear about today, is that we want to find a permanent home to continue the work. And I think you'll see why it's important to continue the work as you move through the presentation. So you think, again, so that's what you're going to hear today, but why was a study needed? You know, why? Because people would ask, why should we have a study just on Black girls in our community? Well, the reason we decided that, here were the facts. We know that Black women make up about 16.1% of the population, but a third of women in our community live in poverty. Black women earn 63 cents on the dollar in comparison to white men. And in Central Ohio, Black babies have been dying at 2.5 times the rate of our white babies. Black women are also 3 to 4 times more likely to die from pregnancy-related issues than white women. So maternal mortality. And something that Councilmember Favor has been passionate about is regarding evictions. 71% of evictions are single mothers, and 64% of those are Black women. 70% of homeless families with children are Black. And you would think that would absolutely go together when you look at the number of people that may get evicted that are Black women. The next step after you get evicted, in many cases, is that you become homeless. We also know that Black home ownership in Franklin County is 33.4%, which is lower than the overall rate in the county of 53.6%. So when you begin to take and these are just a few of the facts that when we deal with the disparities in this community around Black women and Black families, that we've got to begin to change that trajectory. And so the response to the facts is, how do we create new paths for Black women? And so beginning early, so we thought, okay, let's understand that we know we have the Women's Commission that Councilmember Favor sits on, and they're certainly looking at issues around women, and they're focusing on women of color. And so I feel really good that the Women's Commission is focused in that area, especially with Councilmember Favor being a part of that and using her voice. But I also want to make sure that we need to we need to start with not only focus on the women that are currently having challenges in our community, but also we need to start thinking about we don't need to continue to have a pipeline of girls and that being the result. So that's why we thought, let's have a commission for Black girls. And again, I know that people thought I've heard from people initially that thought, why are you focusing on Black girls? Well, I think those statistics are sharing why. If you're going to solve issues and problems, you have to be able to share, this is where the concerns are, and we have to first go to where the concern is to be able to help Black women be successful. But overall, if we provide these resources, have to understand it will help all girls and women to be successful. So we chose two amazing co-chairs, Frederick Bertley, who's the president and CEO of COSI, Dr. Bertley, and then we also Fran Frazier, who is the founder of Rise Sister Rise, two amazing organizations. And then we said, okay, we wanted to have a total of 25 amazing commissioners that would come from the private sector, the nonprofit sector, to be able to provide perspectives on the importance of making sure that Black girls are going to be successful. And so we've heard from the religious community, and I'm going to go back to our slide. I'm sorry. So we had the religious community, we have the Department of Safety. We've had, again, a number of organizations from the Links to the the National Panhellenic president. We've had the Human Service Chamber, United Way, Franklin County Adam Age, Juvenile and Domestic Relations Division. Go to the next slide. These amazing individuals. So Columbus City Schools, Grody and Turner, Nationwide was represented, Amazon, YWCA, Nationwide Children's, Columbus Public Health, the Center for Healthy Families, the Ohio State University, Franklin County Children's Services, Easton Steiner Associates, and Rise Sister Rise. We also had a young lady on our team as a commissioner, but again, we've had some amazing leaders, and all their names are here, who helped us to present, who helped to give us insight, and that's why the work that we're going to be hearing about today. So the charge was really to think about, for this commission was for the last 2 years focused on understanding what is the quality of life of Black girls in Central Ohio, in order to share their story with this entire community. And the way that we gathered that information were from these report methods. The first was we looked at prior research, and there was some really good work from not only through the U.S. Census had information on girls, but we also had information on the Rise Sister Rise, the Kerwin Institute. So there have been organizations that have been focused in providing us with some prior research, and we took that information. We surveyed 422 girls. They completed the 90-question survey. We had focus groups of girls, and then we also had listening sessions with girls. parents or guardians of girls, and they provided their input to us. And then we had monthly learning sessions, and so we heard from a lot of different organizations that work with our girls. And then that's how we have created this report. And we will now share some of the information from the report. So again, I mentioned we had 422 brilliant young leaders, and it's important to always begin to talk up to when we mention our girls, we should always try to make sure that we're speaking positive words into our girls. And we have 422 brilliant young leaders, and we had 29% were 11 to 14, 57% were 15 to 17, and 14% were 18 to 22. 10 identified as being transgender, 15% identified as being bisexual, 3.3 self-identified as being gay. There were 14 zip codes that had a representation of 10 or more girls, and many of those zip codes are areas where we have Celebrate One neighborhoods. This next slide really shows where the zip codes in which the girls came from, and I mentioned there was a significant number from our Celebrate One neighborhoods, but not all. So what I also want to make sure that I'm stating is that the girls that were surveyed, we made sure that we surveyed girls in public school, private school, that we made sure they were from different socioeconomic representation. We made sure that there were girls who were in the juvenile justice system. So we wanted to make sure that we were targeting, girls through different demographics so that we could hear their story. And so what did the 11 to 15-year-olds tell us? They told us that 47% of them live with their mothers only, and so 22% live with both of their parents. So this will be important as we move through this. 59% of those girls told us that they live in rental homes. So as I've always saying to Councilmember Favor, that our girls are living in rental homes, and we know that when you're constantly living in rental homes, you're subject to be able to move more frequently, that parents cannot really build any wealth if you're in rental housing, but almost 50% of our girls are living in rental homes. The majority of them, as you can see, attended public schools. 40% gave their own GPAs at 3.1 or higher. 45% said they've been bullied. Almost 57% said they attend church. And 50% have parents who have been arrested. Not to say they've been convicted, but they've had to deal with some trauma by even a parent being evicted. Not convicted, but arrested. And then almost 58% said they struggle with the feelings of depression and anxiety. So if you begin to think about who they're living with, some of the challenges based upon the challenges that families could have, then it's kind of easy to see why some of our girls are dealing with depression and anxiety. But what makes them happy? 85% of them said their music makes them happy. Family came in at about 80%, and then their friends at 78%. So even thinking about what Councilmember Favor stated about, we just had a conference with our girls. I think what the girls told us what they miss most is that they miss being with their friends. Because they even though they're able to, maybe talk to them on social media or use social media, they're missing their friends. So then what did the 16 to 22-year-olds tell us? So 34% of them live with their parents. 23% of them have experienced homelessness. 71% reside in rental homes or apartments. 87% are in school. 11% of them are pursuing a college degree. Again, 53% said they've been bullied at school, and 51 attend church. 38% have been arrested. That's a little bit less than the 11 to 15-year-olds. 72% struggle with feelings of depression and anxiety, but what also made them happy, again, the same as with 11 to 15-year-olds, music, family, and friends. And then all girls have received 70% of our girls have received some sort of detention or suspension or expulsion. 70%. So our focus groups, where they tell us that they would not talk to a mental health professional. They also said they love being, they saw themselves as being intelligent and smart and funny and loving and creative and pretty and passionate. So they do think really well of themselves, which is great. And also some of them have dealt with food insecurities and housing insecurities. And they also said the young parents, which I think that our present CEO for the Center for Healthy Families, we have some young parents who also said they were experiencing some housing independence, but there's challenges that come with that. But they still are happy to be able to have a place, and that they're working, and that they have received, continue to get their education. The listening sessions, again, we heard from parents and caregivers, service providers, and Black girls. And this will become important as we get to the recommendations, because we got a lot of great information in the report just from those 3 different groups of individuals. We also heard again from subject matter experts in the areas of physical and reproductive health, mental health and emotional well-being, education, gender identity and sexual orientation, child welfare, homelessness, leadership and mentoring, juvenile justice, and social media. And in the report, even though we won't spend a lot of time on that today, the actual report actually has some of the results of the presentations from each of those subject matter experts as to what we can do to move our girls forward with their needs. All right, so some of the other findings of this report, we focused on through the survey aspect. And again, I just mentioned the subject matter experts provided information that are also part of the recommendations. But when we looked at the survey, we looked at really 3 significant pillars of thinking about a girl's quality of life. The first being the economic context, because again, and that's going to be where a girl's economic context is generally based upon their parents, unless we're talking about the girls who are graduating from college. Other than that, it's their parents. We're looking at the emotional and mental health, and then we look at the academic context. So let's talk about economic context. Some background information, so to think about, and then we hear what the girls told us. So in Columbus, about half of all Black children under the age of 18 live in poverty, about 48%. And that is just not acceptable. And that's why it's so helpful what Councilmember Favors did with the Women's Commission. And so as the educational attainment of women increases, again, the likelihood of living in poverty decreases. So it's really important that in terms of our adult women, we need to be making sure that we need to provide our Black moms with increased opportunities to be educated so that they can be able to make more money. The median income, there is a direct correlation between a parent's income and their education. Individuals with a bachelor's degree make about 65% more in weekly earnings than those with only a high school diploma. So if education matters, it does. So let's look at this next slide. So just think about it. If you have a high school versus even a high school grad. So if you're a high school, you can make $520 a week if you have less than a high school. So that means you may make, if you do not have a high school diploma, you may make $27,040 annually. You begin to think about what that means. If you're a high school graduate, you make about $712. So that means you're living on $37,000 and raising a family. So we can begin to see from the earlier slides, and we'll continue to kind of follow this path as to why we see what's going on with our girls and their parents. So then you compare a high school versus a college graduate. So you had a $520 if you were less than high school, and you make 27,000. If you have a college degree and you're making $1,173 weekly, you're making $60,996. So it's a 125% increase versus less than high school to a college degree. These are all sources from the Bureau of Labor Statistics. So again, if a parent earned the median income based on their educational attainment from our girls, if parents earn the median income based on their educational attainment, most respondents who took our survey would be living with parents making less than $37,000. Let's go to the next slide. So what the girls told us, you think about those numbers. So 280% of this, we said 422 girls answered the questions. This particular question, when asked about their parents' educational status, so for the girls that knew, 385 of the girls knew. And of the girls that knew that information, 280, which is 73%, said they stated they are living with parents with a high school education or below. 73%. So Columbus women who have a bachelor's degree make about $20,000 more per year than women who have a high school diploma. So So now you can begin to understand why our girls are maybe living with family members and having, anxiety, depression, the family members are being evicted. You can begin to see because of they don't make enough money. That's just the bottom line. So again, the Ohio median income for a Black woman versus a white male, again, $33,710. That's the median income, and for a white male, $53,532. And so I know Councilmember Favor knows, and certainly Ms. Safford, that we've been involved in, thinking about equal pay day, and when finally a Black woman is able to receive the same amount of money that a white male makes. So if a white male made $53,000 in 2020, it will now take a Black woman to make that same amount of money to August of 2021. That's what that means. So a woman is making less money, which means it's hard to provide for her family. And again, this is showing kind of the weekly earnings that we just mentioned a few minutes ago. There's the difference in having less than a high school diploma to having a degree. And that's why it is so important, not only for us to do everything we can possibly for the parents to increase their skill set, whether it be through a degree or being in a job training program that will certainly increase their salaries. Because I'm not saying a 4-year degree has to be for every single person, but you certainly have to be able to provide resources as a community to our families and to our women so that they can be able to make more money. So thank you. So let's go to the next slide. So our girls told us in this section that they can be moving frequently, can get in the way of building the necessary human capital and social capital. Let's go to the next one. 12% of our girls said they moved at least once per year, and another 20% said every 2 to 3 years. So just think 32% of the girls that took the survey are moving every 2 to 3 years. And just think about that in the context of, I hope our viewing and listening audience is that, you could count, some people could count on just one hand the number of times they've moved in a lifetime, much less the frequency of where going with our girls. And so again, the rental versus homeowners, 63% say they live with their parents or other adults. They rent where they're living. 27% live with a parent or an adult who own their house. And 6% rent an apartment with themselves or a partner. And less than 1% live with a roommate or partner roommate. So most of our girls are renting living in, parents are living in rental properties. And even the girls who may be in college certainly can rent, and we understand that. But our girls who are 11 to maybe 18, the majority of them are living in rental housing. They also told us that 60% said they had not experienced homelessness without a caveat, but 40% did have experienced homelessness at some point. And that, so 21% of all respondents said they had not been homeless before, but they had to stay with the family or friends for a while. So 40% did that. And at the time of this survey, 3% said they were homeless when they took this. Our girls that are working, this is again, all this is part of our economic context. 45% of our girls 15 years or older had a part-time job. 45% of them were all, so they're going to school and they're still working, many of them to provide extra resources to their families. So 45%. So think about what that also means for them trying to do their schoolwork and keep up. They're having to also work. 10% were working a full-time job. An additional 26% said they had been employed in the past, but they were currently unemployed. So now let's talk to the other pillar that we said were important, is a girl's emotional and mental health. So when you think about mental health, and this is, it says, higher poverty is also correlated with a higher prevalence of serious psychological distress. But it's interesting that even with that, thinking in that term, Black people have still lower levels across the board. And that's because we have certainly, based on the numbers we've been talking about, we have lived in situations with lack or less for such a long time that our overall mental health is serious psychological distress. We are still lower than any other group of individuals. So that, I think that's the resiliency that I believe that we have. It doesn't make it right. It's just the numbers are lower. So also in terms of background, we know that our support generally has come from through formal or informal relationships, and most of ours have been informal relationships. An average of only 10% of Black women sought mental health services between 2008 and 2012. They didn't seek that. Also, what we're going to see in this section when we think about our girls is that the ACEs. And for those people who are not familiar with that, it's the adverse childhood experiences that through the Kaiser Permanente, that there are, the more ACEs you have, they certainly can mean that you may have more neurodevelopment, social, emotional, and cognitive impairment, and the adoption of more high-risk behaviors, disease, disability, social problems, and early death based upon the ACEs. And the next slide will show that the ACEs is really about it's a questionnaire that young people take, and it asks really about abuse, household challenges, and neglect that may have occurred during the first 18 years of life. And I know Ms. Safford, and certainly in your previous work and in the work that you're doing, you're well aware of the effect of those ACEs in a young person's life. And so, again, the more ACEs a child experiences, the more likely she is at risk for a range of negative outcomes. So again, we've got to make sure that our children are in healthy households. 33.8% of Black children overall have had 2 or more ACEs. As poverty increases, the prevalence of ACEs, 2+ ACEs, also increases. So if a child is in poverty, the more ACEs they're going to have. Even though they may be dealing with some of this more in a resilient way, they're still going to have, the ACEs are going to occur. And the more the ACEs occur, it will have a negative outcome on that person's life. So, in terms of the ACEs, our average score for our girls was a 3, but 40% of them had higher than that. 40% of our girls were higher. So that 60% had it. So an average of 3, but 40% was higher. So already then our girls are at a place where it has an adverse impact on their lives. Bullying, 50% had experienced bullying, 20% online. They were, and some said they were bullied because of them being a girl, some because of race, some because of colorism. Our girls also told us they long for connection with Black female peers. They like being around each other. 40% said that they were impacted by depression. And they also, when talking about let's talk mental health, they said that there was a mistrust and an unawareness of services. But they also said to us they wanted to get, when they wanted services, they want services from people that look like them. And that's why there's a need for us to make sure that we are having more female and African American mental health professionals. And so when we get back with some of the recommendations, is certainly to make sure we're reaching out to medical schools, we're reaching out to them to be able to recruit more individuals who want to come to their colleges and to be able to bring more people in of color. And then, but who do girls talk to? They talk to their friends, 64% to their friends. Now, mind you, we also know that the friends know just as much as they do, but if you're educating their friends, and I will say this, that we have a group of girls that are part of our girls advisory team for the Commission on Black Girls, and I will state that they certainly, yeah, they do talk to each other, but they're also reading and wanting to learn more about mental health. There is, through one of our partners and our co-chair, Fran Fraser, Rise Sister Rise, they have a Black Girls think tank, and they're focused on mental health. And so you have girls who are now sharing tools to be able to help girls to move forward. So they talk to their friends, and then they talk to their mothers. And generally, most of them are living with their moms. So that's who they feel comfortable talking to. And also you'll find, as we look at the recommendations, the importance of providing the mothers with tools to help their children. And then the pursuit of happiness, again, music, family, and friends, 70%. So that's how they get their joy when they're dealing with behavioral, when they're dealing with their mental health and well-being. And again, as I'm sharing information, we're moving through, I know these slides, but the report is just rich with lots of data. And so the third pillar was the academic context. And in this particular pillar, we know he learned a number of things. So one, there's a term called adultification. And this term, as you can see in the slide, where all the girls in their shadows, or two of the girls' shadows are their actual shadows, and the girl in the middle, the Black girl, her shadow was really tall as an adult. And the reason why that is because it's something called adultification. And adultification is that there's a study that's out that is that girls 5 to 12 are seen as adults. Black girls 5 to 12. They're seen as they're not looked at the age that they are. They're people's perception of them, and they're treated as if they are an adult. They also have taken on some maybe adult responsibilities, but they are viewed as from a sexual context to where they don't need nurturing. They don't, as a girl their same age that would not be a Black girl, they don't need nurturing and caring and motivating. This is how our girls are perceived by adults who took this survey. They're looked, and so if you're looked at as an adult, then adults treat them that way. And so they're not able to even to make mistakes as other girls may make because of their perception of them being an adult and being treated as such. And that is not the case. Our girls need to have the love, the support, the care, and be treated the same as a girl their same age. But that's the background. They are disproportionately punished. So our girls, just as I stated, that 70% of our girls had received some sort of disciplinary action within the school system, whether it's in school suspension, out of school suspension, etc. That our girls have been disproportionately punished, generally about 5 times more than their white counterparts, based upon just them being a Black girl. They also outperform their males and in school, and they get higher grades than the males. They're graduating more than the males, but we need our males to be graduating too. We need our Black males to be doing well, but our girls do outperform them. And we also found out that our girls are rarely considered for gifted programming or AP classes. So what do the girls tell us? I mean, that they would rather than receiving guidance for pruning their, raw leadership, the girls say they get punished. So if a girl is certainly being, speaking up, sometimes that's viewed as a negative, as opposed to seeing that's real leadership potential, to understand what that really looks like. So we need to make sure that they are not being punished for, so they get leadership opportunities. And so they need to be making sure that this again talks about the out of school suspensions, but we need to prune their leadership potential. They also told us that 83% have in the past been involved in extracurricular activities, with 20% saying they do so every single school year, and they really enjoy being a part of those activities. So we need to make sure we have those opportunities for them. Also, the majority of the girls, in terms of their academic support, they're getting it from someone, including their teachers, 73%, a friend, 63%, or their parents, around 59%. So if they're needing academic support, they do have people around them to help them to move forward. In terms of the girls' absenteeism in school, so 22% of the girls said that they have been considered chronically absent because they miss 2 or 3 days a week. And so we need to have an understanding as to why that happens for our girls, because we need our girls to be in school, every day. And I will also share that this pandemic has not helped girls' academic performance. It really hasn't helped children's academic performance. And so our kids are falling behind during COVID. And so we already had some that were behind before, and now we are certainly seeing more of that. So we need to make sure that we're thinking about the effects of COVID are not just the effects of them medically. There's so many other effects of being in a pandemic. And one of them is our girls and all children with their being able to continue their academic success. So, but in here, 3% of the girls say they miss more than 5 days a month, and most of those girls are 16 and older, including a number of college students. So the girls' educational aspirations, 60% of them surveyed said they had a GPA of 2.6 or higher. So that's good news. 2.6 or higher, and including 41% with a GPA of 3.1 higher. So again, that's good news. And 85% of the girls said that if they wanted to go to college, that they could. Their career aspirations are things like being a teacher, a lawyer, a hairstylist, a nurse, a doctor, a cosmetologist, a chef, a surgeon. So every career aspiration that other girls have. And so we need to make sure that we are helping to make sure our girls are able to meet those career aspirations and, motivate them so they're able to meet those career aspirations. And we have to share with our girls the importance of that, to be be able to make the money so they're not continuing to be in a state where they could be possibly in poverty. They also said they want to see positive role models. They told us that, I mean, from the conference we just had with our girls, that they love seeing positive role models like the two women that are on this call today that are sharing positive role models. These girls look up to that. They don't see enough of that, and so that's important. They want to see positive images of themselves. And they also want us to support our Black girls. And I will just say that since we have created the Commission on Black Girls and the activities that we have been doing, our girls have really been really pleased, and they're seeing the support that we have for them, from the back to school rally to the summit to having the billboard on Broad and High and in Easton and other places. They are so happy that we are talking about girls as opposed to talking about the guys. And again, they need all the support, but we're focusing on them, and that makes them really happy. As we move forward, then, the strategies and recommendations from this report. So the first one is that, again, I mentioned that the commission was a 2-year commission, and it was a 2-year temporary commission, but it should move into a permanent entity. And just by me sharing just some of the information in the report today, I would hope that the viewing and listening audience will see the importance of having a permanent entity that will help our girls to move forward. And as they move forward, our community moves forward. So the first, so a permanent entity, and that we should also mobilize. We have to continue to mobilize all of our stakeholders to help our girls. We need to leverage every commission member, even though this entity was until the end of this year. They have spent over 2 years really focusing on this work, and want to continue to leverage them as we move forward as this work. Engage really thoughtful leaders, and then lastly, expand the public's understanding as to why this is so important. And again, I think I shared that some people may think, well, why are we focusing on Black girls? I hope that some of the information I've shared today has certainly made it important. You will now see why it's important, because it will help our community. So we have besides the overarching recommendation, we have 3 other strategies and 18 recommendations that will continue to be a work in progress as this moves forward. This will be a living and breathing document that this work will not change overnight. The situations that our girls are in will not change overnight, but we have to be working on it. We have to be working on this every single day. And so the 3 strategies, and we'll move through those. The first strategy is to create, because let me step back. So the reason we are having a conversation about Black girls, and not just girls, I think I've shared the information in this report, but the number one factor is I have to talk about Black girls. So I have to talk about race. So we need to create an environment that's free of racism, that impairs the ability of Black girls to see themselves. Go back, Dad, please. Can you go back to the last slide? To an ability for Black girls to see themselves and be seen in a manner that fosters their ability to develop and maintain a positive quality of life perspectives to the same extent as their non-Black peers. So they want an environment that could be free of racism so they can be all that they can be. So, okay, to do that, there are the recommendation will be to address historical practices of institutional and systemic racism. This report is coming out in a very timely manner, because if you think about our community, and we're having focused discussions in council, but all throughout this community, of understanding what the role that racism has played, not only in the past, but how it's played into our futures. And so to have those discussions, we can freely talk about what these are and to make change occur. And so I'm just very happy to live in a city where we are having these conversations and people are open to making change regarding racism in our community. And so we have to talk about that. And I'm saying these things, especially in this report, to understand the historical practice of racism for our girls. For our girls. The next slide, please. And then we're also talking, training is a part of understanding. So when we wrote this report, it was training, and training comes in a number of ways. Not just being not only in a classroom, but reading, seeing documentaries, gaining information as to how we got to where we are in regarding to where our girls are certainly not having their very best quality of life. Thank you. The next strategy is that create and strengthen holistic, systemic approaches to address and disrupt these pervasive cycles of education, health, and economic society inequities that adversely impact the progress of girls toward their individual quality of life goals. And to do that, here's a number of ways we will that's in this report. We would have focus on education. So I'll just give you an example. To work within the educational system that will make sure that our girls are not being suspended or expelled or their classroom time disrupted based upon how they're punished. And I just have to say this. So Columbus City Schools is our most significant partner in the city of Columbus in terms of girls going to school. But again, this is also with all the others. But Columbus City Schools played a significant role in this commission. And based upon that, I will just share that there is couple individuals. I have to acknowledge them. So one is Miss Stephanie Patton, who was the principal of Columbus Preparatory School for Girls. And Miss Patton worked with Dr. Monique Morris. And Dr. Morris, she has written 2 books that are focused on making sure that we don't discipline our girls just through suspensions and, expulsions, etc. She's written a book called Push Out, and there's a documentary on that book. And then she has another book, I think it's called I want to say Dancing the Blues Away. That's not exactly it, but she has 2 books that are out, and that she also runs a nonprofit focused on this work. And so Dr. Monique Morris, had we had the opportunity before COVID, our goal was when we release this report, Dr. Monique Morris was going to be a part of that, a part of our initial introduction of our report to the community. And that is because she worked with Stephanie Patton, and now Stephanie Patton utilized a lot of the tools and techniques that Dr. Moore stated were so important for our girls to move forward. And just the success of the girls at the Columbus Preparatory School for Girls has truly been amazing. Stephanie Patton has now been promoted to she is a regional supervisor over all the schools on the east side, and from elementary, middle to high school. And she will be sharing those techniques also with the schools within her quadrant. But also there's a commitment. Miss Alicia Gillison was on our commission. There is a commitment which is part of all of this working together, is that Dr. Morris will be working with the Columbus City School system so that our girls will certainly throughout the system be utilizing those techniques. And so it's really amazing that based upon this work, Ms. Gillison on the commission that we now have, and Dr. Morris has also worked closely with Fran Frazier and Rise Sister Rise, but now because of all this work, she will now be working with our school system to help turn our girls' lives around. And the reason why I'm saying that is a recommendation that was part of the overall the second strategy was to be able to think outside the box as to how we are going to deal with any perceived disciplinary issues, to turn that whatever created that issue, to understand why a young lady may be acting a certain way at school, and how do we turn whatever that be, figure out what was going on, and how do we turn that young lady's, figure out what the concern was, and how do you turn that around for a positive to move the girls' lives around. So that's just one example. So education is one. Go ahead. The next one was to focus on primary health and mental and emotional well-being. That will be very important. We certainly, as I mentioned, one of the recommendations would certainly be that there's a greater need for women of color to be able to help provide the mental and emotional well-being support for our girls. We also know that our girls want to see, just physicians, professionals that look like them. And so there are a number of recommendations that are under each of these recommendations. There are a number of action steps under each of these. And then economics, what do we need to do to move our families forward, as well as preparing our girls for a future where they will not continue to have to be as concerned about their economic stability, because they'll be in careers for that. So those three areas, I would say that they're probably under each of those, maybe 15 or 20 other action steps that were a part of our plan to move our girls forward. The third strategy is to advocate for resources and initiatives that will enhance their quality of life pathways for our girls. There are a lot of pathways that sometimes our girls have had to that have created some that they may perceive that we need to enhance the pathways through different organizations to help them to move forward. And I'll give you some examples as we move through this. So let's talk about the very first one is teen pregnancy. I have to say that the Center for Healthy Families has done an amazing job for young ladies and pregnant and parenting teens that they've been able to provide them with the tools and the resources and work with partners for our girls to have success. And I just have to kind of share one story that, and Ms. Safford can share lots of them, but when we were at our back to school rally for our girls, one young lady who had received services from the Center for Healthy Family, she came to the back to school rally, driving her own car, a nice car, we'll say that, with her daughter in the car. She has finished school. She's working for the Center for New Directions, and she is doing amazingly well. And that is because we have organizations, and this one we're talking about teen pregnancy, that are focused on making sure our girls complete school, have the tools and resources to help not only the pregnant and parenting teen, but the family of that teen, because we're talking about a teen, and to help the young people to move forward. And so this is why, and we know that we have had a significant number of girls, Black girls, that have become pregnant and parenting teens, and we need to make sure that, again, we're helping them as they move through that period of their lives. So we have recommendations there. The next one is gender identity and sexual orientation. We got to make sure that our young people from the LGBTQ plus community are getting the resources that they need. And because even though we're already a Black girl, we've talked about a lot of other issues and concerns, then we also need to recognize that, we all come with, unique opportunities that may require us to do some additional, provide additional resources for success. So then we are focused on child welfare. the number of our children that are in the welfare system. How do we help support them? Again, working with partners. It's not saying this report is really about advocacy. There will be some things that I think we do to support them and some big events of, but it's advocacy with partners. But our partners are being mindful of these are Black girls and what are the unique needs of Black girls. I will just share that I think on the 9th, where the Black Girl Magic will be happening through Franklin County Children's Services to provide, ethnic products and toys for girls who are girls who are in the foster care system. Other issues around child welfare, homeless youth. We know that we've heard these are all the presenters that present to us as subject matter experts. So what we know that based upon what we heard earlier about how difficult it may be for our children based upon the economics of their family, that we have a significant number of Black girls that are homeless in this community, and what's required for them to move forward. Then our girls said that we need to provide more mentoring, leadership, and creating connections for them. We heard one young girl said she had never heard of Girl Scouts. Look, I was a Girl Scout, so that's been a long time ago. So I'm just saying that is important. We have to help our girls there. All right, let's move forward. So safety, community engagement, and juvenile justice. And we have statistics that show us that our girls are certainly involved and have been victims in terms of they're safe victims of assault. And certainly we have girls that have shared with us that they have not only been victims, but they've also been, girls have been more suspects in the criminal justice system more than kind of any other group of people within our community. They're viewed as suspects. So what do we need to do to support our girls there? As well as community engagement, they want to be involved there. And then the juvenile justice system, and we had Judge Gill really share a lot of information with us about the girls in the juvenile justice system. And she talked about we want to support the behavioral health juvenile justice initiative. Next slide. And our girls stated that they, the majority of them had stated that they are either are going to church, or they certainly believe in a higher power. How do we support those institutions to be able to make sure they're helping our girls to be able to, we know that to be able to use their spirituality to help them to navigate their quality of life. And then we need to, again, focus on collective self-development and through virtual communities. The next slide, please. Help our girls with some of their own self-governance. Really have conversations around and work around intimate relationships. Help with the parenting gaps, as I mentioned, that the girls mostly live with their moms. How do we provide the moms with tools that they need to help their girls? Our girls are certainly, even to get to places, and this is an issue throughout our community. How do we get girls to, to these amazing programs, or how do we help them to get to their appointments? What are the transportation needs of our girls to get to amazing programs? And then we have to have data disaggregation. That means we've got to be able to work with our partners to pull out even more information as it relates to girls, so we can be able to help them improve their lives. And so again, those are the three strategies. We have one overarching recommendation, and that one happens to be, again, the Commission on Black Girls has, as of January the 1st, because remember we said that December of 2020, we would move from a temporary agency, a temporary group, to a now more permanent organization. And so we moved from our temporary status on January 1. the Commission on Black Girls will have a permanent home that will focus on some of the information I've shared today, the 3 strategies and 18 recommendations. I am so pleased to announce that the Center for Healthy Families will be the organization that will continue the work of this commission and to help improve the lives of Black girls in our community. And I'm so pleased that I want to say thank you to Toshia Safford, the president and CEO, but also a thank you to the board of the Center for Healthy Families for saying that they appreciate this work and are willing to take this work forward to improve the lives of our girls. And now I'll turn the floor over to Toshia Safford.
Good afternoon, and thank you, Council Member Tyson. It is an honor to be here with all of you. So hello to Councilmember Favors, as well as President Hardin. On behalf of our board, our staff, but more importantly, the youth and families that we serve in Central Ohio, thank you. Thank you for the opportunity for us to be able to continue to drive social change in our community. I just have to take a minute and pause because the report, Councilmember Tyson, as you laid out, and the 2-year journey that it's taken to get there is a bit overwhelming. It's overwhelming of the dedication that you have shown in these years, in addition to your chairs and my fellow 24 plus commissioners. So thank you. I don't know if our community at this point can fully appreciate the work in the space that we're growing to today. Simply put, the Center for Healthy Families, we build bridges. More than 13 or maybe 14 years ago, my co-founder, Donna James, and I, we had a bright idea. And in that bright idea, we simply wanted to create social change for girls and women. And for more than 13 years, the Center for Healthy Families has engaged pregnant and parenting teens in the transformation of their current circumstances so that they emerge with a new perspective and direction for the future. How we deliver on services with our resource advocates, and at times I call them angels, and they are led by an amazing woman and clinician, Director Harris. We provide an incredible context for the work of the Commission on Black Girls. Perhaps even more valuable is how we drive positive outcomes. Our model is the product of intentional, productive collaboration that drives sustainable systemic change. It is measured and refined through a disciplined, data-driven approach and works diligently to keep all partners aligned with the same information, research, and experiences. Consequently, the youth and the families that we serve are able to realize their goals despite the many challenges and obstacles that they've overcome. At the Center for Healthy Families, the model has been designed and managed to be an effective collaboration model that achieves measurable outcomes, not only that benefits youth parents, their children, but more importantly, our community. The DNA of the Center for Healthy Families is to leverage the collective. And as our community has heard today from Councilmember Tyson, the overall recommendation of the report, if you have an opportunity to look at page 74, is that the commission will focus on engaging the community in implementing strategies and recommendations proposed in the report. The input collected in the report will serve as the basis for launching the establishment. So we are more than thrilled and excited that the body of research presented by the Commission on Black Girls study will be the launch pad for our advocacy, public policy, and information pillar. So with the commission, we'll strive in the next chapter as the proven approaches leveraged by the center will now be used to push forward those recommendations and to positively inform and transform the lives of Black girls in Columbus and Central Ohio. On any given Wednesday, we serve more than 84% girls of color. I want you to understand that teen pregnancy is just the symptom of what brings young girls to our doors. We improve the lives of Black girls. And when we do that, it benefits all girls. It benefits our community. The report shows, as Councilmember Tyson said earlier, that girls have challenges within their schools and their own communities, showing that there are systemic issues holding back our Black girls, which leads to Black women experiencing high levels of homelessness, receiving less help and resources for mental health, and also earning a lower wage than her white counterpart. We have a lot of work and energy as we're working as a community to move women forward. Understand that building wealth is integral to women's economic security, good health, and just overall well-being. Wealth enables women to weather unexpected economic hardships, and it provides us with resources that allow us to have proactive control over our lives, giving us the chance to pursue educational degrees, business ventures, and any opportunity. But I need you to understand that for girls of color and women of color, the wealth gap is especially bleak. Single Black women own 2 cents on the dollar compared with all single men. And I'll say that again. Single Black women own 2 cents on the dollar compared with all single men. Understanding that the causes and consequences of these gender and racial disparities in wealth is essential to increasing the economic security and well-being for women, families, our community, and our nation as a whole. Women, especially women of color, face numerous obstacles to wealth accumulation throughout their lifetime. And as we are moving forward as a community, we recognize that these wealth gaps have historical roots in discriminatory policies, structure, and systemic racism. So with the conveyance, the center will double down on our work to go upstream. And we have to be in a position to own that it's never going to change unless we shake the system. And understanding that the system is broken. We will be intentional not to do the same thing simply because it's not enough. Breaking the cycle of disadvantage that perpetuates racism starts with all of us now. We're so grateful for the opportunity to serve. And as the report calls for engaging the community, leveraging data, transforming the lives, changing perspectives, and propelling progress, the Center the Center for Healthy Families and our work, the mission and programs that we do will intersect and focus on this report. We have successfully coordinated a complicated system that has positive results for our young people. We will continue to build and manage productive partnerships that use data to guide decision and actions. And the overall hope, not just for the center, not just for Black girls, not just for women, but for our community, is to shift the understanding and perceptions and issues surrounding a very vulnerable population. I thank you. I look forward to engaging you. And as we move forward, the plans within the next year is to put together the infrastructure so that we can continue to drive change. We want the community's help and support. We will continue to engage the 25 or more commissioners that we have, in addition to the youth advisory group. I'll stop there because I probably can keep going on and on. But once again, to Councilmember Priscilla Tyson and our council members that are with us today, thank you.
Again, first of all, I just want to say thank you, Mrs. Safford, Ms. Safford, for being here, and certainly the kind words that you have given us today. I'm very appreciative of Councilmember Harden and Councilmember Favor, who have been here for this hearing. And before I move on and I think Councilmember Favor may have had to go to another meeting, but certainly appreciate her and my other council colleagues who are supportive of this work. And I know Council President Harden is still here, and I'm going to see if he wants to make any additional comments. And again, I want to thank him for, in this report, certainly in the introduction of this report, Council President Harden certainly has been very supportive of the work of this commission, and put a message in our report supporting this work. He and Mayor Ginther have stated how important this work is. And so I would like, if Council President Harden wants to make a few comments, turn the floor over to him.
Thank you, Councilmember Tyson, to your commission, to Ms. Toshia, to your staff, your team. I think Toshia said it right. I don't think the community can appreciate right now the amount of work that has gone into this, and then the effort put behind it. I just want you to know, and I want the community to know, that the council stands in lockstep. It stands behind you as we do this important work in making sure that our young Black girls have every access to opportunity that anyone else has to prosper in this community. And if this year has taught us anything, is that we have to be intentional about our work. We have to call out the impacts of racism. And the truth is, it wasn't as easy to do this work 2 years ago when you started it. I won't call out names, Councilmember Tyson, but I remember I heard it myself. Well, why don't they just focus on girls, not just Black girls? But the data said that we must focus, that we needed this focus on Black girls. And like I've said with some of the work that I've done with young boys of color, when you lift the boat for young Black girls, guess what? You lift the boat for all of our girls. And so I'm very appreciative. But to your point also, this is just the first step. Now we're looking forward to this transition in creating a permanent home for the commission, and codifying and instituting this as work that will live on beyond even our tenures just on council, but live on for the long run, and commitment of the city that will have these young girls back. But thank you again for your leadership, Councilmember.
Thank you, President Harden. And I would agree with you. I also heard that too. And those comments were why? And or why don't you make that commission part of another commission? And it's like, we've got to be intentional about our work. I feel like, when I think about the homeless shelter and I realize who was there and the kind of dollars we continue to send to the homeless shelter, who's there. And so if you don't begin to understand why Black women are there and try to do something, gotta do something about it. So, I couldn't back down from that, because I understood if you're going to solve a problem, you've got to understand why the problem exists. And then you can begin to solve the problem. And I think that we are, with this report and it going to the Center for Healthy Families, we are going to solve some community problems that we have while we make sure that that Black girls, and then all girls, will have some opportunities to be able to really enhance their quality of life. That's what this is all about. And at the end of the day, we may never hear from other girls that will tell us, "You changed my life." We may never hear that thank you, but we absolutely know that this work will do that. And I have to say that, when during COVID, what we just did with the back to school rally and the summit, and I will have to share what the girls said about the summit, it makes this work all worthwhile. They immediately feel better about themselves and have given them the courage to keep kind of moving forward. And so, again, I am appreciative of President Harden and certainly his support. And as he stated, he is my colleagues' support, and that they want to continue to support the work because they do know that it will help move our community forward and solve some of our greatest community issues. And that I believe that the Center for Healthy Families, because of what you've already demonstrated, and you haven't taken on any new work in about 12 years or so, I think that you're ready to take on that additional work and moving forward. And I'm grateful that to you and your board for saying we are going to take this work to the next level and help girls as you've been doing and help more girls. So on behalf of a grateful council member, I want to just again say thank you. I look forward to our continued partnership as the commission transitions to the Center for Healthy Families. It will begin there. They will have it 12/1. I don't want people to think that they've got to hire their teams and they've got some work to do, but we are going to, on a Monday, should my council colleagues support this, we will be beginning to fund this work so they can bring on a staff to ensure that they have the capacity to move this work forward. This, again, is a living, breathing document, and we need to provide them with the tools to be able to bring the right team together to move our community forward and our girls forward. And they will certainly be looking to other organizations to support this work of this amazing nonprofit. So the work of the Commission on Black Girls has truly been a passion project that I've undertaken and I've nurtured. And with the work of the Commission, who I have to again just say thank you, and we were able to accomplish over the last 2.5 years, I am certain that a foundation has been set that will allow the Commission to thrive. More importantly, the foundation will allow the Commission to continue to build and make a positive impact on the Black girls' lives in Central Ohio. I would be remiss if I didn't again mention that we have been vigilant during this time. The girls are coping with the increased stress of COVID. They're feeling isolated, as well as many of them are taking on more responsibilities, caring for siblings and household chores while they're also feeling isolated. I mentioned this, but again, to address some of those issues and concerns, we worked with a host of partners to create the Black Girls Soar campaign to soar through this pandemic. We hosted a back to school rally in August, and on November the 18th, we held a summit with content focused on Black girls. There's also billboards featuring our advisory council, which consists of 17 girls, and it's on the corner of Broad and High, but they're at Easton and they're in the Short North. They're all over the city. And the final phase of this campaign is a television show featuring girls, and it's also featuring Black girls, and also Black girls will also have helped us and to create the shows, will premiere December the 28th on CTV. Finally, the council meeting this Monday, as I stated, we will absolutely be able to, again, to transfer, the transition will begin by the funding of the Center for Healthy Families on December the 14th. And again, before I conclude this hearing, I would like to thank Toshia Safford, President and CEO for the Center for Healthy Families, and her staff, who I know is working diligently to ensure that there is a smooth transition coming to the center. The commissioners and the co-chair, Fran Frazier, Frederick Bertley, we would not be here today if it weren't for their hard work. and the numerous partners and consultants that have supported the work of the Commission over the last 2 years. We could not have done this work without those partners and consultants. There's just no way. And I also want to thank my fellow council members for their support and the staffs who serve with our community with pride every day. The Legislative Research Office, Chris Maitland, and my staff, Nicole Harper and Carl Williams. I want to thank Angela Burks from the City Clerk's Office. Ms. Burks coordinates the technology that allows us to hold these virtual hearings, and then the hardworking staff of CTV who make these hearings possible. But most importantly, I also want to thank the residents of Columbus. Just say thank you for allowing us to serve and me to serve you. And again, thank you for joining us for the Health and Human Services Committee hearing. We are now adjourned. Thank you.